Recognize Dr. Murphy.
Thank you, Mr. Chairman, and thank you guys for holding this. I think this is an issue really that we have a lot of bipartisan support. I will tell you point blank, I'm a fan of MA plans with a caveat. They do decrease hospitalization. We do have managed care. We prevent people from getting sicker, absolutely. And I tell you, when I was doing my research yesterday, I applaud you guys for actually doing it right. I applaud y'all for doing it right. What I'd like to see are the United Healthcare, the Humana, and the Aetna sitting in front of us, because they have bastardized the system and they have ruined Medicare Advantage to what it should be. You guys are doing it right. I went down to Puerto Rico several months ago. 95% of the Medicare patients are on Medicare Advantage. They do it right. United left after 3 months because they couldn't squeeze enough money out of the system. So you guys are doing what it's intended to be. And just as like with PBM programs, it was started out with a good plan. But when profit and actual fraud happens, this is a problem. Mr. Chairman, I have an article here, How Health Insurers from the Wall Street Journal, imagine that. They're five good articles that I would love my colleagues to read. How health insurance racked up billion in extra payments from Medicare Advantage. I'd love that submitted for the record. It shows how, especially United Health Group, I'm calling them out and I'll continue to call them out.
Without objection, so ordered.
There's some people that are probably going to end up going to jail because of the way they've ruined the system. The second thing is how United Healthcare, army of doctors, they're the largest employer of physicians in the country, how they mobilize them, how they militarize them to upcode. I'd like to submit that article also for the record.
Without objection, so ordered.
Thank you. You know, I've gone through this a couple times with my colleagues here before I ask any questions of what has happened with what's gone wrong with Medicare Advantage, taking a good system where you guys are doing it well and taking it wrong. There's a diagnosis that, poor Dr. Miller, I've seen that look in your eyes when you've been up all night. I got that look so many times. Actually, some of my colleagues had that a few weeks ago. We've gotten a little used to it here. We don't want to, though. United Healthcare diagnosed something called secondary hyperaldosteronism in 3/4 of their enrollees. 3/4 of them. It's only 3% on fee-for-service. They are ruining a good system. And sadly enough, we have seen the nation respond against insurance industries. You know, after the tragic death of the United CEO, there were hundreds of thousands of dollars donated by people to the defense of the guy who murdered him. That's the outrage that we're seeing. So, you know, guys, we have to correct this, and this is a bipartisan issue. We can't throw away a good program, but we can throw away bad actors, for sure. Dr. Miller, God bless you for staying up all night. Thank you very much. Can you tell me, do we need the STARS rating system?
Absolutely. Not measuring quality is a mistake, whether it's the quality of a physician, a hospital, or a health plan. I think the problem with the STAR quality rating program is that the STAR quality rating program does not apply to fee-for-service as a health plan or ACOs, and that fee-for-service as a health plan, ACOs don't have an opportunity to get that bonus. And I think the other problem is that there's no downside. So ideally, the STARS quality rating program would apply to fee-for-service, Medicare, ACOs, and MA, and have upside risk and downside risk, and that's something that Max could help with.
Yeah, and I agree completely. This is something, you know, when managed care, or rather MA plans came in, especially with United, they would undercut. I couldn't take their patients. I had patients that I've been seeing for years, and all of a sudden they got Joe Namath brought them in, and I can't take them because they don't pay anything, or their denial rate was insane. This is something this committee, and actually this Congress, should change. The STAR system, I'm still not 100% sold on because I don't see its efficacy, but for that matter, it would be great to have it on the other side. Tell me a little bit, private practice-wise, Dr. Miller, I know you're not in private practice. How can private practice survive in the world of Medicare Advantage?
So private practice and the opportunity for a physician to own and operate their own business and compete is getting crushed. So when you finish medical school residency fellowship, you can go work for a large tax-exempt hospital corporation, you can work for a large university health system, you can work for the VA. It is hard to own and operate your own business. There are legitimate concerns about induced demand in a fee-for-service setting. Medicare Advantage is not that. We should look to empower private practice as a viable alternative to large tax-exempt hospital monopolies and have a Stark waiver in a managed care setting to make private practice great again.
Thank you. You know, I'll just say this, the insurance lobby is the strongest lobby in this town. It has strangled this place, and it is time for Congress to take back what was originally intended for health care and not let the insurance industry strangle this country. Thank you, Mr. Chairman. I'll yield back.